Rheumatoid arthritis. Rheumatoid arthritis is a condition that can cause pain, swelling and stiffness in joints. It is what is known as an autoimmune condition. This means that the immune system, which is the body's natural self-defense system, gets confused and starts to attack your body's healthy tissues. In rheumatoid arthritis, the main way it does this is with inflammation in your joints. You may have symptoms of pain and inflammation in your fingers, hands, wrists, knees, ankles, feet, toes. How does a normal joint work? A joint is where two bones meet. Most of our joints are designed to allow the bones to move in certain directions and within certain limits. For example, the knee is the largest joint in the body and one of the most complicated. It must be strong enough to take our weight and must lock into position, so we can stand upright. It also has to act as a hinge, so we can walk, and needs to twist and turn when we run or play sports. The end of each bone is covered with cartilage that has a very smooth, slippery surface. The cartilage allows the ends of the bones to move against each other, almost without rubbing. The joint is held in place by the synovium, which contains thick fluid to protect the bones and joint. The synovium has a tough outer layer that holds the joint in place and stops the bones moving too far. Strong cords called tendons anchor the muscles to the bones. What happens in a joint affected by rheumatoid arthritis? If you have rheumatoid arthritis, your immune system can cause inflammation inside a joint or a number of joints. Inflammation is normally an important part of how your immune system works. It allows the body to send extra fluid and blood to a part of the body under attack from an infection. For example, if you have a cut that gets infected, the skin around it can become swollen and a different color. However, in the case of rheumatoid arthritis, this inflammation in the joint is unnecessary and causes problems. When the inflammation goes down, the capsule around the synovium remains stretched and can't hold the joint in its proper position. This can cause the joint to become unstable and move into unusual positions. In addition to affecting your joints, rheumatoid arthritis sometimes affects other parts of your body, including your skin, eyes, mouth, lungs, heart, kidneys, salivary glands, nerve tissue, bone marrow, blood vessels. What are the symptoms of rheumatoid arthritis? Rheumatoid arthritis affects everyone differently. In some people, joint symptoms develop over several years. In other people, rheumatoid arthritis symptoms progress rapidly. Many people have time with symptoms, flares, and then time with no symptoms, remission. Symptoms of rheumatoid arthritis include pain, swelling, stiffness and tenderness in more than one joint. Stiffness, especially in the morning or after sitting for long periods. Pain and stiffness in the same joints on both sides of your body. Fatigue, extreme tiredness, weakness, fever. Does rheumatoid arthritis cause fatigue? Everyone's experience of rheumatoid arthritis is a little different. But many people with rheumatoid arthritis say that fatigue is among the worst symptoms of the disease. Living with chronic pain can be exhausting, and fatigue can make it more difficult to manage your pain. It's important to pay attention to your body and take breaks before you get too tired. What are rheumatoid arthritis flare symptoms? The symptoms of a rheumatoid arthritis flare aren't much different from the symptoms of rheumatoid arthritis. But people with rheumatoid arthritis have ups and downs. A flare is a time when you have significant symptoms after feeling better for a while. With treatment, you'll likely have periods of time when you feel better. Then, stress, changes in weather, certain foods or infections trigger a period of increased disease activity. Although you can't prevent flares altogether, there are steps you can take to help you manage them. It might help to write your symptoms down every day in a journal, along with what's going on in your life. Share this journal with your rheumatologist, who may help you identify triggers. Then you can work to manage those triggers. Causes of rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disorder and is the result of your body's immune system attacking healthy body tissues. However, the specific causes or triggers of rheumatoid arthritis are not yet known. If you have rheumatoid arthritis, your immune system sends antibodies to the lining of your joints as part of the disease process. These antibodies attack the tissues lining your joints, causing the lining cells, synovial cells, to divide and contribute to inflammation. During this process, chemicals are released that can damage nearby bones, cartilage, tendons, and ligaments. If rheumatoid arthritis is not treated, the joint will become damaged and lose its shape and alignment, eventually becoming destroyed. Risk factors. Factors that may increase your risk of rheumatoid arthritis include: your sex. Women are more likely than men to develop rheumatoid arthritis. Age. Rheumatoid arthritis can occur at any age, but it most commonly begins in middle age. Family history. If a member of your family has rheumatoid arthritis, you may have an increased risk of the disease. Smoking. Cigarette smoking increases your risk of developing rheumatoid arthritis, particularly if you have a genetic predisposition for developing the disease. Smoking also appears to be associated with greater disease severity. Excess weight. People who are overweight appear to be at a somewhat higher risk of developing rheumatoid arthritis. Complications of rheumatoid arthritis. Rheumatoid arthritis increases your risk of developing osteoporosis. Rheumatoid arthritis itself, along with some medications used for treating rheumatoid arthritis, can increase your risk of osteoporosis. Osteoporosis is a condition that weakens your bones and makes them more prone to fracture. Rheumatoid nodules. These firm bumps of tissue most commonly form around pressure points, such as the elbows. However, these nodules can form anywhere in the body, including the heart and lungs. Dry eyes and mouth. People who have rheumatoid arthritis are much more likely to develop Sjogren's syndrome, a disorder that decreases the amount of moisture in the eyes and mouth. Infections. Rheumatoid arthritis itself and many of the medications used to combat it can impair the immune system, leading to increased infections. Protect yourself with vaccinations to prevent diseases such as influenza, pneumonia, shingles and COVID-19. Abnormal body composition. The proportion of fat to lean mass is often higher in people who have rheumatoid arthritis, even in those who have a normal body mass index, BMI. Carpal tunnel syndrome. If rheumatoid arthritis affects your wrists, the inflammation can compress the nerve that serves most of your hand and fingers. Heart problems. Rheumatoid arthritis can increase your risk of hardened and blocked arteries, as well as inflammation of the sac that encloses your heart. Lung disease. People with rheumatoid arthritis have an increased risk of inflammation and scarring of the lung tissues, which can lead to progressive shortness of breath. Lymphoma. Rheumatoid arthritis increases the risk of lymphoma, a group of blood cancers that develop in the lymph system. Types of rheumatoid arthritis. There are several different types of rheumatoid arthritis. Knowing which type you have may help your healthcare provider choose the best type of treatment for you. Types of rheumatoid arthritis include seropositive rheumatoid arthritis. If you have seropositive rheumatoid arthritis, you have a positive rheumatoid factor or anti-CCP blood test result. This means you have the antibodies that cause your immune system to attack joints. Seronegative rheumatoid arthritis. If you have a negative RF blood test result and a negative anti-CCP result, but you still have rheumatoid arthritis symptoms, you may have seronegative rheumatoid arthritis. You may eventually develop antibodies, changing your diagnosis to seropositive rheumatoid arthritis. Juvenile idiopathic arthritis, JIA. Juvenile idiopathic arthritis refers to rheumatoid arthritis in children ages 17 years old and younger. The condition was previously known as juvenile rheumatoid arthritis, JRA. The symptoms are the same as those of other types of rheumatoid arthritis, but they may also include eye inflammation and issues with physical development. Seropositive rheumatoid arthritis. Seropositive RA is the most common type of rheumatoid arthritis. This type of arthritis may run in families. Seropositive rheumatoid arthritis may come with more severe symptoms than seronegative rheumatoid arthritis. Symptoms of seropositive rheumatoid arthritis can include morning stiffness lasting 30 minutes or longer, swelling and pain in multiple joints, swelling and pain in symmetrical joints, rheumatoid nodules, fever, fatigue, weight loss. Rheumatoid arthritis isn't always confined to the joints. Some people with seropositive rheumatoid arthritis can experience inflammation in the eyes, salivary glands, nerves, kidneys, lungs, heart, skin, and blood vessels. Rheumatoid arthritis in the hands. Arthritis in the hands may start as a low-level burning sensation that you feel at the end of the day. Eventually, you may experience pain that isn't necessarily from using your hands. This pain can get quite severe without treatment. You may also feel swelling, redness, warmth, stiffness. If the cartilage in your joints wears away, you may notice some deformities in your hands. You may also have a grinding feeling in the joints of your hands, fingers, and large joints, if the cartilage deteriorates completely. As the disease progresses, fluid-filled sacs or synovial cysts typically develop in the wrists, knees, elbows, ankles and around the small joints of the hands. These cysts aren't without complications and tendon rupture can occur in some cases. You may also develop knobby growths, called bone spurs, in the affected joints. Over time, bone spurs can make it harder for you to use your hands. If you have rheumatoid arthritis in your hands, your healthcare provider will work with you on exercises that can help you retain movement and function. Exercises, along with other types of treatment, can help reduce inflammation and delay progression of the disease. What is early-stage rheumatoid arthritis? Providers sometimes use the term early rheumatoid arthritis to describe the condition in people who've had symptoms of rheumatoid arthritis for fewer than 6 months. What are the 4 stages of rheumatoid arthritis? Stage 1. In early-stage rheumatoid arthritis, the tissue around your joints is inflamed. You may have some pain and stiffness. If your doctor ordered x-rays, they wouldn't see destructive changes in your bones. Stage 2. The inflammation has begun to damage the cartilage in your joints. You might notice stiffness and a decreased range of motion. Stage 3. The inflammation is so severe that it damages your bones. You'll have more pain, stiffness and even less range of motion than in Stage 2, and you may start to see physical changes. Stage 4. In this stage, the inflammation stops but your joints keep getting worse. You'll have severe pain, swelling, stiffness and loss of mobility. Rheumatoid arthritis diagnosis. Diagnosing rheumatoid arthritis can take time and may require multiple lab tests to confirm clinical examination findings. Your healthcare provider will use several tools to diagnose rheumatoid arthritis. First, they'll ask about your symptoms and medical history. They'll also perform a physical exam of your joints. This will include looking for swelling and redness, examining joint function and range of motion, touching the affected joints to check for warmth and tenderness, examining for skin nodules, testing your reflexes and muscle strength. If they suspect rheumatoid arthritis, they'll most likely refer you to a specialist called a rheumatologist. Since no single test can confirm a diagnosis of rheumatoid arthritis, your doctor or rheumatologist may use several different types of tests. They may test your blood for certain substances like antibodies, or check the level of certain substances like acute phase reactants that are elevated during inflammatory conditions. These can be a sign of rheumatoid arthritis and help support the diagnosis. They may also request certain imaging tests, such as an ultrasound, X-ray, or MRI. Tests not only show if joint damage has occurred but also how severe the damage is. A complete evaluation and monitoring of other organ systems might be recommended for some people with rheumatoid arthritis. 2. Blood tests for rheumatoid arthritis. There are several tests to evaluate rheumatoid arthritis. These tests include rheumatoid factor test. The RF blood test checks for a protein called rheumatoid factor. High levels of rheumatoid factor are associated with autoimmune diseases, especially RA. Anti-citrullonated peptide antibody test, anti-CCP. This test looks for an antibody that's associated with rheumatoid arthritis. People who have this antibody usually have the disease. However, not everyone with rheumatoid arthritis tests positive for this antibody. The anti-CCP test is more specific for rheumatoid arthritis than the RF blood test, and often is positive before the RF test. Anti-nuclear antibody test. The anti-nuclear antibody panel, ANA, tests your immune system to see if it's producing antibodies to the nucleus of cells. Your body often makes ANA antibodies as a response to many different types of autoimmune conditions, including rheumatoid arthritis. Erythrocyte sedimentation rate. The ESR test helps determine the degree of inflammation in your body. The result tells your doctor whether inflammation is present. However, it doesn't indicate the cause or site of the inflammation. C-reactive protein test. A severe infection or significant inflammation anywhere in your body can trigger your liver to make C-reactive protein. High levels of this inflammatory marker are associated with rheumatoid arthritis. Rheumatoid arthritis treatment. Treatments include medications, rest, exercise, and, in some cases, surgery to correct joint damage. Your options will depend on several things, including your age, overall health, medical history, and how severe your case is. Medications for rheumatoid arthritis. Many rheumatoid arthritis medications can ease joint pain, swelling, and inflammation. Some of these drugs prevent or slow down the disease. Drugs that ease joint pain and stiffness include anti-inflammatory painkillers, like aspirin, ibuprofen, or naproxen. Pain relievers that you rub on your skin. Corticosteroids, like prednisone. Pain relievers such as acetaminophen, Tylenol. Your doctor will typically give you strong medications called disease-modifying anti-rheumatic drugs, DMARDs. They work by interfering with or suppressing your immune system's attack on your joints. Traditional DMARDs are often the first-line treatment for rheumatoid arthritis. Methotrexate, Rheumatrex, Trexall, which was first developed to treat cancer. Hydroxychloroquine, Plaquenil, which was created to treat malaria. Leflunomide, Arava, sulfasalazine, azolfidine. Biologic response modifiers are man-made versions of proteins in human genes. They're an option if your rheumatoid arthritis is more severe, or if DMARDs didn't help. You might even take a biologic and a DMARD together. The doctor could also give you a biosimilar. These new drugs are near-exact copies of biologics that cost less. Biologics approved for rheumatoid arthritis include abatacept, Orencia, adalimumab, Humira, adalimumab auto, Amjevita, adalimumab adaz, Hyrimoz, adalimumab ad, Siltezo, adalimumab ifs, Abrilita, adalimumab BWWD, Hadlima, and adalimumab FKJP, Julio. Anakinra, Kineret, baricitinib, Alumion, belimumab, Benlysta, certolizumab, Cimzia. Etanercept, Enbrel, Etanercept SCZS, Erelzi, and Etanercept Pro, Edicavo, Golimumab, Simponi, Simponi Aria. Infliximab, Remicade, Infliximab Tib, Inflectra, Infliximab Obda, Renflexis, Infliximab Axc, Absola, and Infliximab QBTX, Ixify. Rituximab, Rituxan, Ceriliumab, Kevzara, Tocilizumab, Actemra, Dofasitinib, Xeljanz, Upadacitinib, Rinvoq. Why are rest and exercise important for rheumatoid arthritis? You need to be active, but you also have to pace yourself. During flare-ups, when inflammation gets worse, it's best to rest your joints. Using a cane or joint splints can help. When the inflammation eases, it's a good idea to exercise. It'll keep your joints flexible and strengthen the muscles that surround them. Low-impact activities, like brisk walking or swimming, and gentle stretching can help. You may want to work with a physical therapist at first. When is surgery needed? When joint damage from rheumatoid arthritis has become severe, surgery may help. Will changing my diet help my rheumatoid arthritis? When combined with the treatments and medications your provider recommends, changes in diet may help reduce inflammation and other symptoms of rheumatoid arthritis. But it won't cure you. You can talk with your doctor about adding good fats and minimizing bad fats, salt and processed carbohydrates. No herbal or nutritional supplements, like collagen, can cure rheumatoid arthritis. These dietary changes are safer and most successful when monitored by your rheumatologist. But there are lifestyle changes you can make that may help relieve your symptoms. Your rheumatologist may recommend weight loss to reduce stress on inflamed joints. People with rheumatoid arthritis also have a higher risk of coronary artery disease. High blood cholesterol, a risk factor for coronary artery disease, can respond to changes in diet. A nutritionist can recommend specific foods to eat or avoid to reach a desirable cholesterol level. Although there isn't a cure for rheumatoid arthritis, early, aggressive treatment will help prevent disability and increase your chances of remission. Rheumatoid arthritis is the most common type of autoimmune arthritis. Rheumatoid arthritis causes pain and swelling in the wrist and small joints of the hand and feet but can also impact the shoulders and knees. Treatments for rheumatoid arthritis can minimize joint pain and swelling and prevent joint damage and deformities. Early treatment will give better long-term results and reduce need for joint replacement. Regular low-impact exercises, such as walking, and exercises can increase muscle strength. This will improve your overall health and lower pressure on your joints. It is important to get the help of a rheumatologist. A rheumatologist is a doctor who treats arthritis and autoimmune disease. There are diseases that can be mistaken for rheumatoid arthritis. It is important to get the correct diagnosis without unnecessary testing. A rheumatologist will help find a treatment plan that is best for your disease.